UK research finds no indication that COVID Omicron is milder than Delta. An early investigation by Imperial College London found no indication that the COVID-19 Omicron form is any less harsh than its Delta counterpart. There is no evidence that Omicron is less severe than Delta, either by the percentage of people who test positive who report symptoms, or by the percentage of people who go to the hospital after becoming infected. This is what a research team led by Professor Neil Ferguson said in a blog post accompanying the study. PCR-confirmed Covid cases in England between November 29 and December 11 were studied using data from the UK Health Security Agency and the UK's Health Service. Patients with a high suspicion of having the Omicron variation were only hospitalized in 24 of the studies, and the researchers noted that hospitalization data remains quite restricted at this time. Until now, the research hasn't been subjected to peer review. The Omicron variation had a 5.4-fold increased risk of reinfection than the Delta variant, according to the research. Even a past infection may not protect against reinfection by Omicron to the extent of 19%, the evidence suggests. Between 0% and 20% of people are protected after receiving 2 vaccines, according to the study. A booster injection increases that amount to between 55% and 80%. Omicron may defy past immunity conferred by both infection and vaccination, says Ferguson, a medical advisor to the British government, in a blog post about the findings. Omicron's ability to evade the body's natural defenses implies it presents a significant and immediate danger to public health. On Friday, the United Kingdom recorded 93,045 cases, a new high. Queues of up to a half hour have formed outside vaccination sites in numerous British cities and towns as the government ramps up its re-vaccination campaign. At this time, the death toll from the Omicron strain seems to be lower than that of previous COVID strains, but health experts have repeatedly cautioned that the sheer number of infections might lead to an overburdened healthcare system and an increase in the number of deaths. However, only a tiny number of individuals were affected by this very mild version, according to the South African doctor who discovered it among her patients. Infection in the lungs seems to be less severe when compared to the original viral strain, according to research released this week by researchers.